total healthcare expenditure in Kenya, according to government estimates, is $3.4 billion US. And the economy of Kenya has grown by about 5-6% for a couple of years. So there's all these indicators that the market is really vibrant.
Kenya is really the country in this region that's been developing that. I think it will be a future hub for that kind of production.
So our model is to solve the social problem. The monies will come later, if at all. Usually they come.
For example, if I have a social enterprise that serves this community, do you think about whether this enterprise can work in another community? Is that a factor that you look at?
Start from your governance, then you can now build your revenue. You can make it attractive so that when someone comes, show growth, that your business is not stagnant. You might not be making profit, but as long as you can show it's sustainable and there is that opportunity for it to grow and expand, then they are willing to come on board and give you that kick. And the biggest challenge is we run our kiosks separately. If you want to attract funding, consolidate.
Consolidation play in the healthcare services is something that we feel we are going to continue to prioritize over the next few years. And that includes pharmaceutical retail, pharmaceutical distribution, clinics, hospitals, etc.
So there's nothing wrong with an entrepreneur saying, I need to make a profit.
You have the liberty to say no to funding. And that means all that happens before they come in. So you must get someone who you have the same values, the same vision, so that they buy into the story that you have.
So I think the number one suggestion would be to find your true north and find your vision long term, and then find the right partner according to that vision. The second thing is one tends to overestimate at the end of the day, the fact of the matter is these guys are people. One can underestimate the importance of personal relationship and overestimate all these legal terms and so on. I think at the end of the day, it is who are these people? Do you like getting a drink or coffee with them or not? And then the question is, how do you influence them? Because they can influence you and you can influence them. That's the reality.
Hire an advisor, to explain to you what are all these things you're getting into. Don't sign a term sheet that you don't understand. We are always challenged to measure not just the return from these investments that we make, but really go deeper and look at taxes.
How tangible is the PPP opportunity? And how realistic is it for entrepreneurs to look at them as an opportunity for growth?
In the healthcare space, I think there is a big opportunity for PPPs to play a tangible role, both on the soft side, which is the talent side, as well as on the hard side, which is the building and equipment side. I think PPPs are necessary. Now, is it tangible? It's getting more tangible, is how I would put it, particularly here in Kenya. Thanks to the government's vision, there is movement, and I hope that it is executed in the manner that the vision lays it out, and so far there's no reason to suspect that.
I think we should also look at PPPs from that angle and ask ourselves, how do we also replicate the idea of the triple helix? How do we bring academia and private sector and entrepreneurs together? Academia will invent the technologies. Entrepreneurs will ask, how can we make money? How do we address the product market fit? And the private sector can both bring in the capital and the skill sets that you need to scale this solution.
So to the investors, I've heard everything is about buying and selling in terms of curative. Nobody is talking about investing in a preventive venture, and the future of insurance should now move from the risk part to the preventive part. what happens, and how should we start?
Management of health information is just quite poor, I would say. We don't have enough data on morbidity, mortality as it should be. And as I see here, we are skewed towards private investment. What is the plan? Are we just investing to grow as many hospitals as possible without information that guides that growth?
Patient care, outcomes driven, sort of kind of research. We don't do that. So yes, we have a challenge there, but there's a big opportunity.
Actually, the next frontier is in data. If I was not doing operations, I would have put my money in data. That is what everyone is looking for.
We want them to invest in a quality hospital management system because we believe this is one way that you can capture data, and if there's regulations that require you to submit it or to monitor certain metrics, it becomes easier for you as a facility and even for the overall good. If the public sector is working, it also puts the private sector on their toes. Yeah? So I don't think the private sector crowds out the public sector. I think the public sector has room to step up